Good day, ladies and gentlemen. My name is Chuk, and thank you guys for being here today. So, for my informative speech today, I will be talking about prescription opioids and the epidemic that prescription opioid medications are causing in the United States. So, basically, back in the 1990s, prescribers of medical insurances started to prescribe opioid medications very frequently. So today, I'm going to explain to you the problems these prescription opioids cause in the society. I'm also going to be talking to you about synthetic opioids like heroin and fentanyl. My main goal for this speech is to be able to inform you about the bad things the opioid medications are causing for patients, the overdose, the death rates from prescription opioids and fentanyl and heroin. And I'm also going to talk about a few ways that we can help eradicate this problem and help better the society gain knowledge on opioid medications. So according to the National Health and Services Organization, about 130 people die each day from opioid medications. 24.6 million people between the year 2010 and 2019 have died from prescription opioid medications. About 2.1 million people just in the year 2018 and 2019 have died from prescription opioids. So looking at these numbers, it's a very alarming rate at which the prescription opioids are killing individuals, and not just only patients, but regular everyday people that have a little pain or have some sadness, and they go take an opioid medication and they get addicted to it. A lot of us has gone to the hospital for like a knee injury or like a knee sprain, an ankle sprain, and the first thing your doctor wants to prescribe you is hydrocodone, Percocet, meloxicam, naproxen, and most times you see people say, no, I'm just going to go try physical therapy, or no, I'm just going to weather the pain. The alarming rate for the opioid medications basically made me want to inform people, but basically my target audience would be the youth, the younger people my age, 23, 24, 25, ages from 18 and above, so they can be able to better inform the society. I work at Aetna Medicare Part D insurance as a pharmacy technician, and one of the things we do have, because I do prior authorizations for medications for patients over the age of 65, and one of the things I do have as a pharmacy tech is we do review opioid medications based on clinical criteria. Now there is something called MCUMI, and every account for each of these patients have an MCUMI tag with it. Now if we load up a patient's account and we send MCUMI, that means this patient has high risk for opioid medications. Another thing that we do have now in the society or with Medicare is the 925 opioid reject. So most times patients go to the pharmacy to get an opioid medication, and if they're going to take more than a 7-day supply, then we know that we have a 925 reject, and the 7-day supply, anything higher than a 7-day supply will reject, and they have to call in to get a prior authorization for the medication. Another medication apart from prescription opioids that really affect the society is heroin and fentanyl. And these are off-the-market medications you get on the black market or on the street. And when doctors prescribe these opioids and they don't give you enough, most patients find a way to go to the streets to try to get something comforting to help them, and they go ahead and try to get opioids like heroin and opioids like fentanyl. The problem with heroin is most of the time heroin is injected into the skin, into the body via needles, and sometimes these needles can get infected, and most of these times these needles are shared, and that's how you get like bacterial infections and other kind of diseases that end up killing these individuals that uses heroin. According to NSDUH, about 12.1 million people have died from the use of heroin in the past 10 years. So we as a society have to help educate people on using better syringes or better needles, and actually cleaning up the needles when they're trying to use medications, opioid medications, or just in general, try to find something else to do if you're in that much pain and you need something to help cure your high or something to help release the pain. So now I'm going to talk about a few ways we as a society can help reduce opioids. One way we can is physical therapy, pain management centers. These are a few things that we can implement into the society. You don't have to always take opioid medications every time you feel pain. You can do physical therapy, or you can go to a pain management center. According to the NIH, there is a few pain management centers that are in the works in Atlanta to help with stopping the use of so much opioid medications. Now you can go to your doctor, and your doctor prescribes the opioid medication, and you can tell him that you prefer to go to a pain management center or you prefer to go to physical therapy. So in conclusion, the most important thing about opioid medications is awareness. Most people don't know that if your doctor prescribes 6 tablets a day, and if you're in so much pain, you should stick to 6 tablets a day. You shouldn't go higher than that, because you start going over your regular prescription, and then you get addicted to it, and then you overtake it, and then before you know, you're overdosing on these opioid medications. My main target was the younger audiences. I want the younger audiences to be able to gather this information and go into the society, because it takes one person to be able to change a lot of mishaps, a lot of things that are done in the society. I want to thank my audience for showing up today. I really do appreciate everybody listening to my speech, and I hope you guys make the world a better place. Thank you.